The month of November, affectionately known as Movember, involves the growing of mustaches, but perhaps more importantly, the month is to raise awareness to men's health issues such as prostate cancer, testicular cancer and men's suicide. Now, the Movember Foundation has been placed to address these issues on a global scale. The foundation also funds groundbreaking projects all over the world, engaging men where they are to understand what works best and accelerate change. To tell us more about their projects and, of course, what Movember is all about is Garron Gsell, who is the country manager of the Movember and founder of Men's Foundation. Garron, a very good morning to you. Thanks for joining us. Welcome to Morning Live. Hi, Garron. Good morning.
Yes, good morning, Superior.
There we go. Thank you so much for joining us. Welcome.
Yes, thanks, man. It's a happy Sunday.
Indeed, it certainly is. Now, so much has been said about Movember, but not everybody knows what Movember is. Do you want to take us through what Movember represents?
Certainly. So the month formerly known as November is now Movember, which is the annual campaign for the Movember Foundation that takes place in over 21 countries around the globe. In South Africa, we grow and raise funds and awareness for the Men's Foundation to invest into developing local projects and awareness and educational campaigns to get men to look at their health in a different way. And if you look at, particularly now during COVID and the impact of the lockdown, mental health is at the front and center. One of the key factors that we realize is isolation. Men having to deal with job losses and also having to face issues surrounding identity and all the other things that go with having to lose jobs.
What are some of the biggest health issues faced by men that needs to be brought to the fore? Do you get a sense that men are educated enough about their health?
Certainly not. I think with prostate cancer being the leading cancer affecting men and the testicular cancer cases doubling over the past 10 years, but with male suicide representing 4 out of every 5 suicides in the country, the most important thing is we're prompting men to take action. We're starting a conversation about changing your appearance and growing a moustache is where we help men to identify with those issues, and by holding peer-to-peer conversations, getting men to start taking action where they wouldn't normally. So breaking down those barriers that men normally used to have towards their health issues.
Now, take us through some of the campaigns that the Movember Foundation is involved in through the month of November.
So, look, the primary campaigner involved in is the Movember campaign, which we obviously use to raise education, but we invested into various different projects. We've got Project Peacock that was initiated at a critical care hospital in Cape Town that we so gladly are supporting. We're looking at continuing funding that going into the future. But there's other programs we're looking at funding being a big challenge to invest into. There's some of our global projects such as the Ironman program. That's all on our website. You can see the various different research and survivorship programs. One of our big programs we're really excited about is our global action plan, where Movember is connecting various scientists across the globe to collaborate and work, and certainly to avoid duplication. We've been able to do things such as mapping out the prostate cancer genome, and then starting to identify what the best forms of treatment are for the 27 different strains of prostate cancer that we've already been able to identify. So it's definitely not a one-size-fits-all when it comes to prostate cancer, and these are some of the things that we look to achieve. But certainly our mental health programs and getting men to have those shoulder-to-shoulder conversations is quite a big one. We've got our Conquer the Curve campaign that we've developed that's in line with COVID to support men with guidance and support with some healthcare professionals, with life coaches, with financial advisors. We're looking forward to obviously investing funding into that. Another one of our programs is also the Movember Rated Barbers, where we're going to be educating barbers as the front line for mental health discussions, and to be able to advise and guide men to seek help if they feel that one of their clients in their chair is not feeling, or to understand firstly that it's okay to not be okay. But our message is very much to become men of more words. But we're quite proud of the fact that also for the Men's Foundation, as we lead into the 16 days of activism, we need to lend our voice to gender-based violence and starting to get men to also start holding other men accountable for their actions.
Yeah, and we're getting reports that the world's first precision medicine for prostate cancer has become one step closer to reaching patients, of course, after approval by the United States. And this is a culmination of a decade of research involving collaboration between scientific teams around the world and, of course, funding from the Movember Foundation.
Yes, we're quite proud of that. That's as you can see, some of our research programs do take quite a bit of time before we can actually see results. That was after 10 years of research and development, and certainly now with us having been part of the development of the first ever national prostate cancer policy with the Department of Health, that's certainly part of the conversations in terms of what access to treatment men are going to be having as we look forward to the rollout of the national guidelines for prostate cancer treatment.
By the year 2030, the aim is to reduce the number of premature deaths of men due to health issues. How will this be achieved?
Look, it's certainly by the type of programs that we invested into and certainly getting them to look at their health in a different way. It's what we're looking to achieve. So, by supporting or investing into survivorship and research programs, that's the first call, but also getting men to start looking at their health in a different way. That they start to realize, when men don't take action, when there's something that's untoward, that starts to lead. We know that early detection is always very key when it comes to cancer, and by getting men to start taking action earlier, that's certainly one of the leading factors. But there's a lot to achieve in the next 10 years for us to reach that target.
So how can the general public get involved in bringing awareness and donating to the Movember cause?
So first off is to go to Movember.com. This isn't only a male-centric campaign. We've got most sisters that support the campaign because our wives, mothers, sisters are also impacted on by men who are not taking care of their health. So that's exactly what we're talking about now with the life expectancy. The emotional impact of losing a loved one or losing a man in your life, whether it be a husband or father or partner. It's important to head to Movember.com as a Mo Sister sign up or as a Mo Bro sign up, be part of our awareness and education campaign. There's absolutely no charge. You can see what some of our communities are doing. You can still participate in the month, even though we've already a week in, and there's still what appears to be a bit of a shadow on my upper lip. But there's other ways to support the campaign. You can either commit to moving for the rest of the month or simply making a donation to support somebody that has undertaken to support the campaign.
All right, Garron, thank you so much for your update. We appreciate your time.
Thank you.
That was Garron Gsell talking to us about Movember and the importance of raising men's healthcare issues through initiatives by the Movember Foundation.